As an accomplished professional photographer, Ed Stewart knows how to take a great photo, but lately he was not liking his own aging picture.
The main reason I'm going in there is because I wanted my lower lids and my upper lids done. I've got a lot of bags underneath my eyes, which I feel doesn't make me feel as confident.
Okay.
And so we started with just doing the eyes, and he talked me into, and recommended that I go ahead and just do the neck lift and the lower, just for my jowls, and just to kind of tighten things up and give it a better appearance.
Now, why are you doing this, though? I mean, is it for your job? You are in a position where you take a lot of pictures. You're a photographer. Does this help your work?
I don't know if it helps so much, but it gives me the confidence to basically go into any situation looking good and feeling good. And I hate to say it, but I think as we get older, some people judge you on your age. And if you're too old, they think maybe you're not up to date with current trends, things like that.
Ed turned to help and guidance from his trusted friend for many years, cosmetic surgeon Dr. Bill Beeson. Yeah, and he told me that 2004 was the first time he came to see you. So I see what you say about the progression. And also then it's not a dramatic change. These are little things that make you look, I think the term you use is refreshed. So you're refreshing him every time you do something. Now he has said that he wants to see you again, and he's very open about his age. He's 58 years old. What is it that you think you can do for him to help, to please him? What are you going to do?
Well, what I tell patients, my bias is based that we want to have something that looks very natural. The best compliment I can have is no one knows you had anything done. They just feel that you look more rested 10 or 15 years younger than what your chronologic age is. We want to have something that's good value in terms of not only how much you spend on something, but how much improvement that you have in that area. And we want to have something that's going to last a longer period of time. There are some things that you do that you have to keep having things done, and whether fillers or other things, and some of those are very good. But as much as we can, we want to have something done that if you never had anything else done, you're always going to look better than you would have you not had that done in that area. The other thing is, I think it's important to realize when I see a patient, I think there are 4 things that they need to answer for the doctor to be able to develop a plan for them. It's what area or areas concern them, how much improvement they want to have, how long they want that to last, and I think the other aspect is how much downtime or recovery are they willing to have in those areas.
Without hesitation, Ed agreed to the facial procedures Dr. Beeson recommended, and the surgery went well. Now it was just a waiting game to see the uplifting results. Fast forward around 6 months after Ed's surgery, and let's check in and have a look.
Well, we did an upper and lower lid blepharoplasty, or eyelid tuck. Ed had some extra fatty tissue called adipose tissue around the eyes. That's more of a hereditary situation, and those are the puffiness that you see. So went inside the backside of the eyelid and used a laser and removed that fatty tissue, and so that gets rid of the bags and the sags. He also had extra skin in the upper eyelid, so we removed that, so that gives him a more open appearance to his eyes. A lot of people are concerned about the scars that people have and don't want to have something show up, and you can't see any of those incisions. It takes a full year to get your final result. He's about halfway through, so it'll get better, but already it looks better. As we age, things drop down. He wanted to have more definition along these areas, so he's still going to get some increased tightening across here, but he still has more of that almond shape and more definition along the jawline. We've been able to hide the incisions around the ears so he doesn't have any telltale signs. Doesn't change his hairline, so hopefully no one's going to realize he had anything done. He's just going to look more rested and more relaxed in those areas.
Is Ed happy with his refreshed results?
If you can afford it and have the extra time, I would do it. It makes me feel better about myself. I'm very happy with the results.
Bottom line, both Ed Stewart and Dr. Beeson are pleased with the outcome, and Ed now feels more confident and ready for his close-up. Smile!